Depression, medically called clinical depression or major depression, is an affective disorder marked for at least 2 weeks in a row by a reduced mood in the face of most situations affecting professional or personal life. It can often be accompanied by low self-esteem, low energy, loss of interest in previously pleasurable activities. Doctors estimate that by 2022 depression will become the second leading cause of disability worldwide, after heart disease. Currently, 121 million people are diagnosed with depression. Researchers believe that only a small number of people realize they are suffering from depression and are willing to seek help. Possible reasons are fear of social stigma, ignorance, and personal pride. The best way to find out if you suffer from depression is to get informed. That's why below you can read about the symptoms of the illness, its risk factors and causes, the main types of depression, how it is diagnosed, how it can be treated, and what can be done to prevent it. Symptoms of depression. The symptoms of depression are complex and vary from person to person. In general, a depressed person feels sad, has lost interest in activities they used to enjoy, music, films, sport, going out with friends, and seems hopeless. Symptoms can persist for weeks or even months and can affect work, family, and social life. Very rarely does a depressed person have all the symptoms. They usually have some of the following: a continuous bad mood, feeling of helplessness, lack of hope for the future, low self-esteem, frequent complaining, feeling of guilt, irritability, intolerance of others, lack of motivation, lack of interest in things, difficulty making decisions, lack of enjoyment of life, continuous feeling of anxiety, suicidal thoughts and thoughts of physical harm, slow movements and slow speech, changes in appetite, weight loss or very rarely weight gain, constipation, headaches, dizziness, muscle and or joint pain, lack of energy, low libido, menstrual cycle abnormalities, sleep problems, avoidance of contact with family/friends, neglect of hobbies or pursuits, difficulties in performing work or household tasks. Causes of depression. The cause of depression is unknown. Psychiatrists believe several biological, psychological, and social factors are involved. Depression is thought to occur when there is a pre-existing vulnerability that is triggered by one or more life events. The vulnerability may be genetic and/or may occur in human development, in childhood or later. Depression can also be a secondary illness to conditions such as HIV/AIDS, asthma, chronic conditions, or terminal illnesses. It is not yet known whether the diseases themselves lead to depression through their effect on quality of life or through common causes, for example, basal ganglia degeneration in Parkinson's patients or impaired immunity in asthmatics. In addition, there is iatrogenic depression, which occurs as a result of medical care. This includes depression caused by interferon, contraceptives, beta blockers, isotretinoin, anticonvulsants, cardiac agents, antipsychotics or gonadotropin-releasing hormone agonists. Even seasonal affective disorder is considered a type of depression. It is thought to be caused by reduced levels of sunlight in the autumn-winter seasons. Diagnosing depression. Diagnosing depression can involve physical examination. Your doctor will perform a physical examination and ask you questions about your health. Sometimes depression can occur as a result of medical conditions, laboratory tests. For example, the doctor may recommend testing your blood and thyroid function to make sure your tests are normal. Psychiatric assessment. The psychiatrist will ask questions about your symptoms, feelings, thoughts, and behaviors. In general, diagnostic criteria from the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, developed by the American Psychiatric Association, are used. Even the World Health Organization provides a set of criteria for diagnosing depression. Prevention. Depression is not entirely preventable. All that can be done is to choose a balanced lifestyle with a varied and healthy diet, physical activity, limiting stress and conflict situations, getting a good night's sleep, reducing alcohol and/or psychoactive substance use. Together, these can reduce the risk of psychiatric problems, including depression, by up to 22 to 38%. Early diagnosis of depression can prevent the illness from becoming chronic. This form of depression should be avoided as much as possible as it requires long-term treatment and there is less chance of success. Reduced interest in favorite activities, anxiety and insomnia for 2 to 3 weeks may require a visit to a specialist. Intervention through psychotherapy or cognitive behavioral therapy in stressful or traumatic situations helps prevent a new depressive episode. Social support programs work better for older people than cognitive behavioral therapy. Along with anxiety, depression is one of the diseases of the 21st century. Limiting its effects can be achieved by changing lifestyle, reducing stress and introducing physical activity into the daily schedule. Once the first symptoms appear, psychotherapy and cognitive behavioral therapy can help relieve them and reduce the risk of chronicity. Severe and complicated forms of depression require both antidepressants and therapy. The best way to avoid complications is early detection of the illness, from the first symptoms. If you want to know more about risk factors and treatment for depression, skip to the next video, and if you like this video, don't forget to subscribe to my channel. Health tips.